Hey folks, we're going to call this one Obama is misleading seniors about Medicare changes. I've been telling you that this new bill for health care is garbage, and got a little backup. Uh, Take it for what you want, believe it or not. This is what I got out of it, and so didn't, Nancy Desmond and Newt Gingrich. Now, I can take with a grain of salt what Newt Gingrich has to say, but he's spot on with this. In a news conference last week, President Obama tried to excite seniors by letting them know the new health care law would fully cover annual wellness exams. It was another example of the president trying to make the new health care law seem like a huge benefit to America's seniors. But if there is no doctor available to care for them, then what's the point of getting a few extra dollars covered by the government? In the past 2 weeks, the Obama administration has been trying to stem the tide of skepticism towards its health care law with a new mailer sent directly to the nation's seniors and disabled entitled Medicare and the New Health Care Law, What It Means for You. The problem is, for anyone who has paid attention during the past 12 months, the message is about the biggest government expansion into health care in our lifetime just doesn't add up. Seniors and the disabled who use Medicare have a new attitude about the supposed benefits to the health care law. Prove it. Let's contrast fact from fiction and the language used in the new flyer. The Affordable Health Care Act, passed by Congress and signed by President Obama this year, will provide you and your family greater savings and increased quality of care. Fact. Most Americans will pay higher insurance premiums, according to an April report from the Centers for Medicare and Medicaid, and more than 10 million seniors will see reduced benefits under their private Medicare Advantage plans. Overall, quality will decline as fewer doctors take on Medicare patients. Your guaranteed Medicare coverages won't change, whether you get them through Original Medicare or through a Medicare Advantage plan. Fact. Medicare Advantage, a private option in Medicare, will be cut by $136 billion. On April 22nd, the chief actuary for the Centers for Medicare and Medicaid Services reported that half of all seniors enrolled in Medicare Advantage would lose their coverage by the new health care bill by 2017. The guarantee that benefits won't change isn't a guarantee at all for millions of seniors who prefer using private insurance companies that provide their Medicare coverage. Your choice of doctors will be preserved. Fact. Cuts to Medicare will total nearly $500 billion, hitting hospitals, home health care providers, physicians, and more. Doctors through the country have seen their Medicare payments reduced in recent years and expect more cuts in the future because of Obamacare. A February survey by 3 national neurosurgeon groups, for example, showed that 50% of neurosurgeons were reducing the number of Medicare patients they were accepting into their practice. The Mayo Clinic in Arizona also has started turning away Medicare patients. Other physicians are following suit. How is this preserving a senior's choice of doctors? If you're hospitalized, the new law helps you return home successfully and avoid going back by helping to coordinate your care and connecting you to services and supports in your community. Fact. This is traditionally known as home health care, a program that helps treat patients at home for a short period. But in the Obamacare plan, home health care will also be cut by $40 billion. Another contradiction in terms. Last fall, the federal government launched an investigation into Humana for sending letters to seniors who are customers of the Medicare Advantage program during the health care debate. It urged them to contact a representative or senator because of the then proposed cuts to the program. Under threat of shutting down the insurance company's contract with Medicare, Humana was told to stop sending such information out to its customers. Yet today we have the federal government offering its spin and fabrication on Obamacare with no one holding it accountable. It is trying to convince seniors that despite almost $500 billion in cuts, the new law preserves and strengthens Medicare. Precious tax dollars are being spent on public relations campaign to try to convince seniors that Obamacare will keep Medicare strong and solvent. Nothing could be further from the truth. Record numbers of baby boomers will start retiring this year and draw Social Security benefits and sign up for Medicare. They are smart enough to understand that Obamacare is not a good deal for their golden years. A 4-page brochure will not change their minds either. It will take more for this administration to prove it than a glossy 4-page pamphlet. Think about it, folks. How is your care going to be preserved when funding for it is cut? How is this better for retired citizens who are living on Social Security and only making $3,000 to $5,000 a month? How are they going to be able to afford it? People, think. This was not a good plan. This was bogus bullshit. Peace out, folks.